We do it thousands of times a day, totally on autopilot, walking. But what if I told you that simple act is one of the most complex and revealing things our bodies do? Yep, every single step is like a sentence in a story about our health. And in this explainer, we're going to learn how to read that story. So this really gets to the heart of it all. Could the way you walk actually be a window into your health? And the answer is a huge, resounding yes. From your nervous system all the way down to your joints, your gait, your walk, is giving off a surprising amount of data. Let's break down how. Okay, so before we dive any deeper, let's get on the same page with our key term, gait. It's really just the fancy, scientific name for your unique walking pattern. I like to think of it as this beautiful, coordinated dance between your muscles, your joints, and your nervous system, all working in perfect sync. And just like any dance, it's got a fundamental rhythm, right? There's a repeatable sequence of movements that scientists call the gait cycle. And this cycle, well, it's the fundamental building block of every single step you take. So what exactly is a gait cycle? It's pretty simple, actually. It's just one complete stride. So imagine you're tracking your right foot. The cycle starts the very moment your right heel hits the ground, and it ends the next time that same right heel strikes the ground. Everything your body does in between, that's one single cycle. Now, here's where it gets interesting. That whole cycle is broken down into two main phases, but it's not a 50-50 split, not even close. For about 60% of the time, your foot is in what's called the stance phase. It's on the ground, supporting all your body weight. The other 40% is the swing phase. That's when the same foot is up in the air, swinging forward to get ready for the next step.
All right, so let's zoom in on each of these phases, because it's in the little details, the stuff happening inside the stance and the swing, that's where the real science comes to life.
So let's start with that stance phase, that big 60% chunk of time your foot is on the ground. It's not just one single event, it's this incredible chain reaction. It starts with that first heel strike, then your foot flattens out to absorb the shock, and then your whole body just glides over that stable foot. It all wraps up when you push off your toes to propel yourself forward. It's a remarkably complex transfer of energy and weight that we do without even thinking. And then, bam, you're in the swing phase. This is the faster part of the cycle, where your foot is in the air. It kicks off the instant your toes leave the ground, it swings right past your other leg, and then it gets ready to land again, starting the whole cycle all over. And get this whole thing happens in less than half a second. It's wild.
Okay, so we've got the pieces of the puzzle, we understand the components. But how do clinicians and researchers actually measure this stuff? How do you turn a simple walk into cold, hard data?
Well, they look at a few key things to build a data profile of your walk. They measure your step length, they check your cadence, which is basically your tempo. A healthy adult usually takes about 100 to 120 steps a minute. They'll time your velocity, which is just your overall speed, and they'll even note your base of support, how far apart your feet are. You put all those metrics together and you get a unique gait signature for every person. And that signature, that profile, is so important. Why? Because when something goes wrong in the body, your gait is often one of the very first things to change. So let's take a look at a few of these abnormal walking patterns. The difference is usually night and day. A normal, healthy gait is smooth, it's efficient, and it's symmetrical. An abnormal gait, on the other hand, can look really irregular, strained, or lopsided. And that asymmetry, that's a huge clue that something isn't right. First up is one that many of us have probably experienced, the antalgic gait. In simple terms, it's a limp. It's caused by pain. The telltale sign is a really short stance phase. It's just your body being incredibly smart, instinctively trying to get weight off a painful leg as fast as humanly possible. If you've ever twisted your ankle, you know this walk. Next, we have the Parkinsonian gait, which has a very distinct pattern. You'll notice these short, shuffling steps and a much smaller arm swing. It's also marked by something called festination. That's an involuntary speeding up. It almost looks like the person is trying to catch up with their own center of gravity. This tells us there are specific challenges in the brain with starting and stopping movement. And here we have the hemiplegic gait, which you often see after someone has had a stroke. The key feature here is called circumduction. Because the muscles on one side of the body are weak or stiff, the person has to swing that leg outward in a big circular motion just to clear the ground. It's a really unmistakable pattern. And all of this really circles back to this one key idea. The way a person walks can be a crucial window into their health. It's so much more than just movement. For a trained eye, it's like a live data stream coming directly from the body's most important systems. So that brings us to the most important part of all. If we can see a problem in the way someone walks, what do we do about it? Let's talk about assessment and recovery. The path to getting better always starts with some solid detective work, a thorough assessment. It begins with the simplest tool of all, a clinician's eyes, just observing the gait. From there, they'll do tests for muscle strength and range of motion, or ROM for short, which basically tells them how well the joints are moving. And finally, a neurological exam checks to see if all the reflexes and coordination are firing on all cylinders. You see, the whole process follows this really clear, logical path. All the data from that assessment helps build a diagnosis. And only once you have an accurate diagnosis can a clinician create a targeted rehabilitation plan that really gets to the root cause of the problem. And this isn't just theory, right? The real-world impact here is huge. Gait analysis is absolutely critical in physical therapy for patients recovering from strokes, for people who've had a knee replacement, for spinal cord injuries, and for managing long-term conditions like cerebral palsy. We're talking about restoring not just movement, but independence and a person's quality of life. All right, so let's just quickly lock in the key takeaways from all this. Remember, the gait cycle is split into that 60% stance phase and 40% swing phase. A normal walking tempo or cadence is right around 100 to 120 steps a minute. And most importantly, that path to recovery always follows that logical flow. Assess the problem, get the diagnosis, and then begin rehabilitation. So, the next time you're out for a walk, just pay a little attention to the rhythm of your own steps. Your walk is as unique as your signature. What story is yours telling? Thanks for watching.